Okay, here we are with Phil again. After the first session, basically we had a treatment on a very old injury on the rib. Yeah, do you recall how old it was?
40 odd years ago.
Okay, 40 years ago. So I treat that one. I showed the difference in between the mobility of the shoulder. The shoulder was heavier and the shoulder was lighter when I was trying to lift his body from lying on the couch. Now it's completely different. I already checked. The improvement that I achieved last time is still there. The pain is not gone because he had other two major injuries. Operation on the knee, operation on the shoulder. First of all, look the head. Now I'm coming on the back. Look at the head, is a little bit bent this way, okay? But now I will ask him to perform this test to see how the spine bends on the left and on the right, okay? This is on the left, okay? Try to look this area here especially, okay? And this area here. Now look, here it doesn't bend at all. And here as well. So he has injury on the knee, which translated is a restriction L3, and an injury on the shoulder because the shoulder was keeping dislocating. I'm sure 100% it was because of the injury here. So you have an injury here on the wrist, this part gets very stiff, this part moves a lot, it twists, and you keep dislocating the shoulder. But then he had an operation on the shoulder, which is an injury, which is a trauma. Okay, please lie on my bed. Okay, now what you can notice here is very clear the difference in the foot. This one looks more relaxed. This one is a little bit more in inversion. Now we will move the camera a little bit closer and I will do the test as I did last time. Now there are two trauma on this side. So left and right, okay? Very, very heavy. If we go here, when this one was the main trouble, this part was the heaviest. I show you at the end of the last video that this side now moves better than this, okay? This one doesn't move. The neck is painful, okay? It's painful, but this side moves better and this side, it doesn't move and it's a lot painful, okay? So two injury that for two different reasons. Injury on the shoulder, brachial plexus, it blocked the neck anyway. Injury on the knee, lumbar spine, the lumbar spine is very connected with the neck. So for two different reasons, he has probably the two worst injury that can affect the neck. So the neck is very painful. Obviously, he will have some trouble on the spine, on the lumbar spine. This side, the left one is more soft. If I touch the paraspinal, this side is a little bit harder. It's not hard as last time, but there are injuries. So I will start with the shoulder because I believe is the main things. Okay, I will start it. I probably keep the camera open. Can you please move on the left? Just move a little bit all your body on the left, like this. Yeah. Okay. Is it visible? Yeah. There is a oh wow. So the scar is a classic scar, very, very big, okay, on this shoulder. The shoulder, obviously, it won't move, okay? The shoulder, it doesn't move at all, okay? This is the important. So the body needs to regain back every single movement because if there is a restriction here, it's not a problem of shoulder. It's a rotation that then you can have here, hard, soft. You can have there, all the body misaligned. If you look at the leg, this leg and this leg, they look completely different. There is a rotation of the pelvis a little bit higher this side, so probably someone will tell him you have a shorter leg, probably it's the left one because the pelvis is a little bit like this, okay, and keeps the leg asymmetric. Still, he can run, he can do his triathlon training, okay? Let's do it. So the shoulder is brachial plexus, so it's a bunch of nerve that come from the neck upper part of the neck up to T1. I stay like that. I need to feel a compression. So what's going on now? The neck is moving toward the right, so it's doing something like this, and the arm is going toward the neck. So there is a compression. So this is a nerve compression. I need to release these things. I do a very, very gentle mobilization. I find a position of ease, and then the body does itself, does release by its own. Okay? Just need to find exactly the spot, and then, which is this one, look, bam. This is completely blocked. This move, the top move, and there is one vertebra, it may be probably C3, C4 is completely blocked. If I hold that vertebra only, okay, I can feel the vertebra moving toward the right. Stay like that. Take a deep breath. Okay. Because L3, the knee, affect the middle part of the neck as well, so that middle part of the neck is affected by the injury plus the knee. So even if I treat the shoulder, I will never feel a full release on the neck because there is still the problem there. But the problem there needs to become harder. So when I try to move L3, the third lumbar vertebra, from right to the left, it won't move and it will be a lot worse than before. Okay, that I know that something shifted and we are progressing. So it will be painful, eh? It will be okay. To me is different. It looks a little bit more soft. Can you return on the middle?
What do you want in the middle?
Yeah, in the middle. Yeah. Okay. Look at this, completely blocked. Now, L3 is basically, I cannot move it. It's still heavier because L3, but it's not as heavy as before, okay? So still the right side is the heavier, but the shoulder itself is okay now. But if I go down, this part is very heavy, okay? This part is very light, okay? There is L3 blocked. There is a clear injury. You don't treat the pain, you treat the injury. Which operation?
Right knee.
Wait, what happened?
It's they removed all the meniscal tears and they've cut a hole in my cartilage.
Okay, so they removed the meniscal tear and they put an hole, they drill an hole on the cartilage because they believe more blood, the cartilage will grow back. Okay. Let's check the knee. Look at the foot. So the foot is already more straight. Okay, the foot. I don't know if you see it. No, you don't see. Okay, the foot is already more straight. Before was in inversion. Okay. So it's important to know the past medical history. I can find it out because people frequently they don't recall injury they had long time ago. How old is this one?
8 years ago, 10 years ago.
And the shoulder? The operation?
I had it done when I was 17, 18, so I'm 53.
But is after the wrist or before the
Yes,
wrist?
after.
After the wrist, perfect. So the body keeps a record of the injury in order of older to newer. So the wrist broke down, he had a dislocation, and then the shoulder was popping out, he had an operation on the shoulder. So the operation is the injury. So first injury, the wrist, the oldest injury he got, then the shoulder, and the knee is the newest. The knee is the newest. I can tell you he had an injury on the knee because of the shoulder operation on the right, okay? Because the shoulder operation create a restriction C3, C3 affect L3, L3 create the imbalance that then supported the injury. So you can injure, even if you run straight, you can injure the meniscus because your knee is not straight. It's not straight. And then you injure it. So you don't really need, most of the time you don't really need a direct impact. Sometimes you have it, but even without it, you can injure a meniscus, you can injure an ACL, you can injure everything. Okay? Just because your body lose the balance and the joints are not straight anymore. Okay? Okay, just put it down. Phil, in terms of operation, did you have any on the pelvis?
No.
You had a car accident?
No.
Not any.
Well, did something to the hip flexor.
Okay. Okay, so there is a kind of, we can say, pull.
Yeah.
Did you, have you seen any black spot there
No.
when it happened? No.
No.
So it wasn't a massive one? No.
It was quite large, but it was it was done by while I was having personal training sessions, so there was an element of just carry on with it.
Okay, so look at the feet. The feet is completely different. It's good. There is an improvement, but still I can feel this part very heavy. So there are other things, obviously. So in his life, he had lots of injury. The foot is very good. So something changed after the treatment on the shoulder. The shoulder, you see, it's quite similar. The pain, if it's true, there is something on the hip flexor. Is on the right. Was it on the right?
Yeah, it's here.
On the right. So everything on the right. Okay. So another injury on the pelvis. The neck is keep improving. Is more flexible. But definitely, if there is something here, this is the left, and this is the right. So it's even. So as long as we remove things, what is left it become harder and harder and harder and harder. Okay. And let's check L3. Let's check L3. You feel? It moves better. So the spine moves better, so it means this one is better, but I was struggling a little bit. In fact, I was here. It was a little bit tough. And then he said, there is an injury here, he just said. So there is still something to...
Oh. Sorry, you need to warn me.
Okay, here there is no movement at all, and here there is a lot of movement, okay? Let's do it.
Right.
Just relax. I need to understand where the hip flexor is the sacrum. The sacrum gives the nerve to this area. Lift a little bit your pelvis. Okay, and relax completely. Yeah. You feel this very, 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 very heavy. Okay. Lift a little bit the pelvis, quite a little. Okay, Put it down. Okay.
And by the way, I just realised I did my hip before I did my knee.
And so, okay. So it's older, these things. Okay. So I was struggling a little bit. There's been a change, but not as big as when I treat the shoulder. So the shoulder treatment improved the position of the foot immediately. The knee, I was struggling. Yeah. Anyway, ooh, wow. So this is the lower part of the sacrum, which is definitely irritated. I can feel my hand is underneath the sacrum. The sacrum is a bone which is just above the coccyx, okay? And is moving. My hand and the sacrum, they are moving toward each other. In fact, here, very, very tender. This side is a lot soft. This side is it's like rock solid, okay? Seems better. Mm-hmm. You feel?
Did you feel all the muscles moving? That's me trying not. I can feel it. I can feel the nerves in my leg as you're playing around with it, and my leg's moving ever so slightly.
Okay, so what happened is, injury here, the sacrum is that bone in the middle of the pelvis, was moving this way on the lower part, okay? Then I can tell there is an, let's call it inguinal damage, okay? Same thing. I wait, blah, 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 release, the sacrum start moving, the spine start doing its fluctuations, called up and down. Good. It's a lot more soft, okay? Look at this foot, how good it is. Well, it's crazy. You will feel a lot better.
Right.
Yeah?
Okay.
Okay.
Yeah, all right.
But that one improved with the shoulder. Now, let's redo the test again. Just relax. Look at this. It is
Yeah.
something else. That's something else. Now, let's hope the neck will improve. But
Sure.
there may be something else, okay? There may be something else. But definitely I expect something. Look at this. Okay? It bends more. Let's see the shoulder. Okay? Okay? In his history of training, he played rugby, so he had a lot of injuries. So I don't expect 100%, but definitely is a lot better. This side is a lot more soft. This injury was before the knee. That's why the knee, I didn't, couldn't.
Yeah. 1, 2, 3.
Okay, so there was something going on here. I had to treat it. Definitely worked. Okay, definitely. It worked a lot, okay? The side is a lot more flexible, is more equal to the other one. This is what we want. This is why the feet needs to be relaxed. If you see that your foot, one is like that, one leg is more straight than the other, definitely there is a trouble. The shoulder is forward, is higher, you are tilted on a side. These are all signs of troubles, okay? We need to fix it. And they can be fixed with technique that you are not aware of. Okay? Thanks for watching.
I couldn't. No.
Let's record this moment. So you couldn't do that?
No.
Okay.
So before, and what I know about it is because when I've had to have work on my back, I couldn't get my hand up this high.
Okay, definitely the spine, it releases. So when it releases, all the muscle left and right moves better. So even if it's the other shoulder on the left or right, it doesn't matter. It's the rotation of the body. We get injured. There are part of the body that doesn't work, and the body tends to twist. And then you can have a pain on the shoulder, on the neck, on the foot. It doesn't matter. The pain never matters.
I fell asleep again.
Yeah, you fell asleep many times. Okay. Now, just quickly, he said the last operation was for the Achilles, yeah?
Yeah.
Okay, in fact, after all these things, treatment, now the left side, the right side is good, but in fact, if I go to the sacrum, this side moves well, look, and this side, okay? So if I grab it here, it moves a little bit, but if I go toward the sacrum, S1, L5, S1, which is the innervation of that area, it's very tender, and that part is connected with the upper part of the neck, right side, left side. So 1 and 2, okay? So again, he has other things. Maybe. Let's see if you can. Let's have a zoom on it. So 1, this is the dorsiflexion, and this one is, if it doesn't go, it's just a little bit over 90 degrees. This one, the end of range is a lot more soft. Okay, so already know this part is kind of okay. This part, okay, is completely stuck. Okay, next treatment, this one, which will be performed this way, sacrum and foot.